Clonazepam, also known as Klonopin, is a medication used to prevent and control seizures, as well as to treat panic attacks. It works by calming the brain and nerves, and belongs to a class of drugs called benzodiazepines. It is important to follow the prescribed dosage and take it at the same time each day for the best results. If you have any concerns or questions about taking Klonopin, be sure to consult with your healthcare provider for personalized advice. Before taking Klonopin, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 2 or 3 times daily. The dosage is based on your medical condition, age, and response to treatment. Remember to take it at the same times each day to get the most benefit from it. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. If used for a long time, it may not work as well, so talk to your doctor if this happens. Klonopin may sometimes cause addiction, especially if you have a substance use disorder. Take it exactly as prescribed to lower the risk of addiction. If you have different types of seizure disorders, consult your doctor if you experience a worsening of seizures when you first start using clonazepam. Lastly, tell your doctor if your condition lasts or gets worse. Some common side effects of Klonopin include drowsiness, dizziness, tiredness, loss of coordination, or increased saliva production. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist right away. It's important to keep in mind that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. A small number of individuals who take anticonvulsants for various conditions may experience depression, suicidal thoughts/attempts, or other mental/mood problems. If you or your family/caregiver notice any unusual or sudden changes in mood, thoughts, or behavior, such as confusion, memory problems, signs of depression, suicidal thoughts/attempts, or thoughts about harming yourself, it's important to notify your doctor immediately. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. Taking Klonopin can be risky because it has the potential for abuse and addiction, which can lead to overdose and death. It's important to take this medication exactly as prescribed by your doctor. It's also important to avoid alcohol and other drugs that can cause drowsiness or breathing problems while taking Klonopin, as this can lead to very serious side effects, including death. Your doctor will likely start you on the smallest effective dose of Klonopin and only have you take it for the shortest amount of time necessary to reduce your risk of these serious side effects. It's crucial to understand how to take Klonopin and to be aware of other drugs that should be avoided while taking it. If you experience slow or shallow breathing, severe drowsiness or dizziness, or have difficulty waking up, seek medical help right away. Suddenly stopping Klonopin can also be dangerous, especially if you've been using it for a long time or in high doses. Your doctor may need to gradually reduce your dose to prevent withdrawal symptoms, which can be serious and even life-threatening. If you experience headaches, trouble sleeping, restlessness, confusion, depression, nausea, or seizures after stopping Klonopin, notify your doctor or pharmacist immediately. Withdrawal symptoms may persist for weeks to months. Before taking Klonopin, it's important to discuss any allergies you may have with your doctor or pharmacist. This medication may also contain inactive ingredients that could cause allergic reactions, so it's best to talk to your pharmacist for more details. It's important to inform your doctor or pharmacist about your medical history, especially if you have certain eye problems, blood disorders, liver or kidney disease, breathing problems, mental health issues, or a history of substance use disorder. Klonopin may cause dizziness or drowsiness, especially when used with alcohol or marijuana. It's important to avoid driving or operating machinery until you know how this medication affects you. If you're using marijuana, it's best to talk to your doctor. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications you're taking, including prescription drugs, over-the-counter drugs, and herbal products. For children, the long-term effects of Klonopin on physical and mental development are uncertain. It's important to discuss the risks and benefits of this medication with your doctor. Older adults may be more sensitive to the effects of Klonopin, and may experience increased drowsiness and confusion, which can increase the risk of falling. During pregnancy, Klonopin should only be used if clearly needed, as it may harm an unborn baby. If you're planning a pregnancy or think you may be pregnant, it's important to talk to your doctor about the risks and benefits of this medication. Klonopin can pass into breast milk and may have undesirable effects on a nursing infant, so it's best to consult your doctor before breastfeeding. It's important to be aware of how Klonopin may interact with other medications you may be taking. This can affect how well your medications work and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medication dosage without consulting your doctor first. Some products that may interact with Klonopin include orlistat and sodium oxybate. Taking Klonopin with other products that may cause drowsiness or breathing problems, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines, could increase the risk of serious side effects like slow or shallow breathing, severe drowsiness, or dizziness. Make sure to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any concerns, talk to your pharmacist about using these products safely. If someone overdoses on Klonopin and experiences severe symptoms like passing out or trouble breathing, it's important to call 911. Otherwise, contacting a poison control center immediately is necessary. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, confusion, loss of consciousness, and slowed or decreased reflexes. It's important to remember that Klonopin should not be shared with others, as it is against the law. While taking this medication, you may need to undergo lab and/or medical tests, such as liver function and complete blood count. Make sure to attend all medical and lab appointments, and consult your doctor for more details. If you forget to take a dose of Klonopin, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. When it comes to storing Klonopin, you'll want to keep it at room temperature and away from light and moisture. It's important to store it in a place where children and pets can't reach it, so definitely not in the bathroom. And when it comes to getting rid of any leftover or expired medication, don't flush it down the toilet or pour it down the drain. Instead, consult your pharmacist or local waste disposal company for the proper way to get rid of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.